Welcome to an incomplete guide to personal growth. We invite you to take a breath and take a listen to our podcast that explores the wonder, humor, challenges, and sometimes those self-inflicted wounds on a journey of personal growth.
Our weekly podcast conversations include stories, resources, and tools that you can incorporate into your daily life. We're the mother-daughter duo of Sydney
And Kelly. Hey, Sydney.
Hey, Mom. Why do you start off laughing almost every time we do these intros? It's so funny.
Because you have this smile face. It just makes me smile and laugh.
Oh, okay, I think that's good.
It is good.
Thank you.
Yeah. So
What?
I went and had a pedicure.
Okay, yes.
Okay. And, I go up to the little place
one by
at the
us.
front neighborhood. There's pedicure places everywhere.
Oh, yeah.
But this is a family-owned. A couple.
It was just like a little, and it's quick, and you can get
small,
in.
Well, and it's just small and quiet compared to the big ones.
Yeah.
And Lauren used to hate going there with me because it was like not enough action happening, And I go in there today, and I called at the last minute, was able to get in, and then they called me and said, "Could you come even earlier?" And so I came in.
Oh, nice.
Anyway, it was really nice. So I'm in there, and another lady comes in. "Today's my birthday," and I said, 89 years old.
Ooh.
Okay, so I'm getting my pedicure, talking to Cindy, who's doing it, and another lady comes in toward the end, waiting to have hers done. She's 90, so I'm thinking,
Oh my gosh.
maybe where I go to get my pedicure is for old people. And they're both talking about how it's nice because it's not so loud in here.
Oh my God, literally all the stuff you just said.
I know. And one was, one asked, "I got this real long hair and I can't get it off."
She did not say that.
So I was going, I really like this place. But it just made me laugh
So
because
gross.
Lauren giving me such a hard time about going there. And it was like,
Obviously, for good
It
reason.
may be for old people.
It sounds like it.
But it's so nice and quiet. And it's convenient. And I don't have to watch 20, 30 people get their feet done. You know, at that one,
I
Venetia
guess,
or whatever that place is, you know. So anyway, is that not
I don't go
funny?
there to get I don't really
No,
do
you
pedicures, but I don't. If I do, I don't.
If you don't, that's not where you choose. So
No. That is so funny. Oh my gosh.
I know. Anyway,
I love it.
they do a good job, and
They
I'm
do
happy.
good. Yes. And you're not that old, but I guess you can go there for a long time.
Yes, that's true.
You can go there for a long time. Oh my gosh. Okay, so this week we're continuing on the second half of our episode with Ana Maldonado. And so last week we talked about CBT, DBT, cognitive and dialectical behavioral therapy. And then this week we get into EMDR and internal family systems. Talk a little bit about finding a therapist, kind of tie it all together, kind of wrap it up between these two episodes. But it should be another really informative experience for everybody.
Yeah, I'm looking forward to our conversation continuing.
Yeah.
This
next one, EMDR, we've both done it. We've both done it.
Can you tell us guys?
I love it. Mine was for my traumatic birth experience, processing through all of that without actually having to talk about it.
Yeah.
And then was yours just for past stuff?
Yeah, it was for family stuff.
Yeah, family trauma stuff.
Family trauma and
So
And then
we've both done it, but we want to hear what you have to say about it.
Yes. I love it. I think EMDR is wonderful. So EMDR stands for Eye Movement Desensitization and Reprocessing. It is the top treatment for PTSD. And PTSD is kind of, there's a range of what that can look like.
It's a broad spectrum, I feel like, for sure.
Mm-hmm.
Yes. So there's acute, which is more like a one-time thing, like a traumatic birth. Right? And there's complex, which is a developmental issue. You kind of grew up in an environment that taught you that a lot of things in life are unsafe, that now as an adult, you break a plate and you're not going to get screamed at and your body does not know that. Right. So kind of, depends on what that's going to look like. But I'm trying my best to not get overexcited because I could go off with this. So I was like, stick to the outline. Yes. So a couple points that I think are important to share. So EMDR is a bottom-up approach. What that means is it targets the bottom of your brain, and then that change moves upward. CBT and DBT are top-down approaches, and most therapy actually, like talk versions of therapy, are. So top-down approaches is by using your higher order functions like logic, which are all at the top of your brain, like reason, past, present, future, meaning making. You rework a lot of those things, and then that changes up all the way down to the bottom of your brain, right? So, and that's really important. Like existential therapy is all about making meaning and finding new meaning in the things that you have experienced, right? And so that changes how you view your past, or it can really help with making peace with your life. And so they're both good. They both have merits. I use bottom up and top down approaches. But the reason that that's relevant is that trauma is stored in your body, not in the highest parts of your brain, and that reaction is at the bottom of your brain. And so a lot of people get frustrated with talk therapy because they're doing these top-down approaches when all of their trauma is stored at the bottom, right? And so like you can logically tell yourself like, yes, I know that a guy isn't going to just assault me, like a guy walking the street. Like I can logically know.
But your body doesn't know
your body doesn't. Thank you, Susan. Yeah, exactly. Your body doesn't know that. And so people get really frustrated because they'll be in talk therapy for years and they will still have these physical jolts and like jumps and scares. And it's just because you're not in the best treatment suited for what your issue is.
Gotcha.
So that's why EMDR is something you should definitely think about. If you feel like you have a lot of somatic reactions, right? If you're really anxious, if your heart just like starts racing all the time, or if your tension in your body just like jolts up at certain moments or triggers, that's really exhausting to live with, just like all of the physiological reactions to things. And so what EMDR does is it through reprocessing your memory in a safe environment, it actually is helping your brain resort out your memory, and it's desensitizing the memory, right? So you're very sensitive, like the jumping, right? You jump because there's a sensitivity there, right? So we work to desensitize it. How we do that? Re-observe the memory from a third person perspective in a calm state of being, right, in your wise mind, like what DBT does. And you complete bilateral stimulation. That's a fancy way of saying that your hemispheres in your brain are alternating. And that's the emotion side of your brain and the logical side of your brain are switching back and forth. That is how you process when you are in REM sleep. That's how you process when you walk. So you're just doing what your brain already does, right? This is the best way your brain can process information, and so we're just manipulating it to be used on a specific memory. So what ends up happening is it kind of looks different for every person, and that's one of the most fun things when you do EMDR with a client. You're like, how does your brain work today, right? Some people will see just the main memory, kind of stay in it. Some people have like changes of angles. What's most common is that your brain is going to bring up associated memories. And so kind of like a dream where like everything is weirdly connected, and then you have a random slice of pizza, and then you're like back to some other storyline in your dream, and it happens. That tends to be what EMDR looks like. So people will get a memory, maybe the initial memories from when we're 6, and then we'll just jump around, like 10, 15, and then random thing from yesterday, and and we just kind of jump. And all we're doing continuously is checking in on your body and seeing, is the intensity of the feeling in your body dropping? Right? And when we get all the way down to 0, that's when we know we have completed EMDR.
That's over the course of like several sessions, generally, right?
Yeah. Depends on the issue, right? So if it's an acute issue, it can be something as quick as like 10. Like if it's just one particular trauma, it could be 3. It like some people are super responsive and will be done in like 1 or 2. And then there's like different subsets of EMDR that have different protocols for different particular issues, which I won't get into, but and then if you have a complex issue, obviously it can go on for much longer.
For a long time. Yeah, for sure.
And I know when I did it, it's rapid eye movement, but I had the little clickers.
Yes.
That go ding, 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 and I have to close my eyes when I do it because otherwise
Yes.
I'm totally distracted.
Oh, really?
But
See,
you did the eye,
yeah, because
didn't
I
you?
didn't like the feeling of the buzzing in my hands. I didn't like it. I hated it.
Yes.
And so then she was like, okay, well, I'll just do this. And she like moved, her hand back and forth. And she's like, is this too slow, too fast? And so she'd
Yeah.
like change, the rhythm and stuff of it.
Yes.
But,
Yeah. See, I couldn't
Yes.
do that.
Yes.
Yeah.
So bilateral stimulation can be done in a couple ways, right? So you can
Mhm.
have alternating buzzing in your hand. Some people do audio, so like there's different
Oh.
sound.
Oh.
Yeah, through your ear. Yeah. You can YouTube all of these things.
Uh-huh.
And some people will do eye movements with either their hands. They'll use a light bar so that your
Oh,
eyes will
yeah.
move right to left.
Oh.
It's pretty amazing.
Yeah.
Like, yeah, and if you ever if you are like struggling to believe that this actually works, go on like a really long walk.
Mhm.
Because most people will have really good insights
Yes.
during walks, and there's a reason.
There's a reason it's not bilateral.
Yes,
Yeah.
your brain is processing information as effectively as it possibly can.
Yeah.
So, yes,
That's so
big
cool.
fan
Yeah.
of EMDR. It works
Yeah.
with basically anything somatic. So PTSD is its most, that's what it was created for, but we're now seeing that it can be used for things like anxiety, phobias. It's also the top form of treatment. OCD, because that's usually a
Wow.
very somatic experience. People panic. Right? The panic is a physical.
Physical.
Yeah.
And then dissociative disorders. So, if you zone out a lot, usually we have to stabilize first using things like DBT before we would go into trauma processing. But most people with dissociative disorders have a history of trauma, so you're treating the trauma. So anything traumatic, and when I say traumatic, I mean physical, right?
Yeah.
Trauma is still in the body. It's not really what's happened to you; it's how you've processed the experience.
Yeah.
That's what actually defines if something is traumatic.
Yeah. It's crazy.
Fascinating.
That
Yes. It's
so
just a fascinating thing for me.
I think there are a lot of strengths to it. Would you say there are some weaknesses in
Yes,
there?
of course. As hard as it was for you to come with some. No, I'm kidding. I sound like one of those like EMDR fanboys. I'm really I like EMDR. Some weaknesses. I actually don't like it as a standalone treatment.
Mm.
I use it woven into a lot of things because I think it can be very in its standard form. It's very clinical, very cold, and very like steps 1, 2, 3, blah blah. I'm not a fan of that. Like I don't do that. I care a lot about relational stuff. I care a lot about the person meeting themselves compassionately. So I like to integrate it with other things like internal family systems, which we'll hopefully have time to talk about, and inner child and all that kind of stuff.
Okay.
So I think as a standalone treatment, it can be very cold. Some people like that about therapy. They like not feeling really, they like go in, do work, and leave. Like, that's fine. Not really my style, but that's okay. The other thing is it requires a lot of distress tolerance and ability to emotionally regulate. So a lot of people with trauma don't actually have those skills naturally most of the time. Unless if they've had really healthy partners and relationships after they've left their traumatic home. It's hard. So a lot of the time people come in wanting EMDR and it's like, we need to prep you for at least
you have to prep for it.
And get you stable before we can kind of do that. Versus other things like CBT, you get to do like first session because it's not
it's not
the pot,
Right.
So but thankfully we have treatments like CBT, DBT.
To help with that.
To get them to that point.
Exactly. So it requires a lot of work. And then the other one, the one that I run into sometimes, it can be very abstract, and some people don't like that. It's a very abstract concept, and then it's one that requires a lot of like letting things happen. And for people with trauma, it's also really scary, right? You have to like be vulnerable. You have to play the memory in your brain, and like your brain may come up with a bunch of other stuff. And people are also like, but what am I supposed to be thinking about? And you're like,
that took me a while. It took me a couple sessions because I was like, so what? I'm just there. Like, what do I do? Like, what's my brain doing? Like, what am I? She's like, no, you just let. It's like, okay. It took me a couple sessions, but once I got into it, like, let yourself get into it, and then
exactly. It's a hard leap, and I think we live in a culture that's like, what am I doing all the time? So to engage in a process where like your job is to be it's like a dream, right? It's like a dream like experience where you're supposed to just receive it. And that's for a lot of people. So I would say those are the weaknesses. It's incredibly effective. It doesn't require talking. So
yeah,
that's
and
a
I think
strength.
that's a strength. It's like
Yes.
a lot of times it's the talking about it that like creates a lot of the sensations. So you don't.
Yeah.
Yeah. And
Yes.
sometimes there just aren't words.
Yeah, that too.
Yes. Yes,
Mhm.
because it never made it to the higher order functions
Yeah.
of the brain. There's
There
no
you
There
words.
you go.
Yeah, because
Yeah.
the higher order function is language,
Yeah.
and we're at the base of your brain. So I had to nerd out. Sorry.
There you go. Love
I'm holding
it.
back this whole time, so it's like
So good. Oh my gosh. All right. I want to get to inner family
Yeah.
systems.
What's it called?
Yes, internal family systems.
Internal.
Yes, I love this theory. It's definitely one of the newer ones. So is EMDR though.
Mhm.
Yeah, EMDR is
Yeah.
pretty new too. Yeah.
Yes, internal family systems is what Inside Out is based off of.
Oh, cool.
Yeah.
Wow.
Yeah. So internal family systems' core belief is that our personality is made up of different parts
Mhm.
to make up our whole selves,
Mhm.
and they actually take on different roles.
Okay.
And so certain parts, though, have been through very painful experiences
Mm.
and have taken on roles to help keep you, your core self, protected and safe.
Mm.
Right. So that could be a protective role, or it could be what's known as the exiled role,
Okay.
which is it's bearing the weight of the pain and it needs to be buried away.
Yeah.
Right. And then that protective role, all it works to do is to make sure that exiled role never comes out.
Mm-hmm.
Right. And the really interesting thing about this theory is that your parts are not oriented to time. And so they don't know that you're now an adult, or they don't know that you now are in a safe relationship. They just know I have to protect core self, right? Core Sydney, core Kelly, by doing X.
Yeah.
Right. And so some core beliefs about there's a lot of strengths about, I think, just like the general theory, right? One is that there's no bad parts. Every part of you is trying to obtain something good for yourself, even if that's just safety.
Yeah.
Yeah.
That's cool.
So the way that internal family systems works is that you enter into your core self, right? Like you start to like actually run your system.
Mm-hmm.
Right? You're updating the system by letting them know, like, hey, I'm a grown up now and I actually can take over, and you don't have to you don't have to keep protecting me in this way.
Oh,
Man.
So it's also a very abstract
Yeah.
modality. You're like talking to parts of yourself. So some people get really freaked out. It's also very somatic. So your parts live in your body. So you talk to your heart. Your chest is tight. You go, hey, like what's going on?
I did just a touch of I did just a touch of that with my EMDR stuff. There were times where we'd like envision, okay, like you have this mason, like I had a mason jar, and it was like, okay, these emotions are, out here and they're over here, and this is what this one looks like, and here are these colors, and it's like, why? Like, what is it doing? Like, is there something else behind it? Like, what's it telling you? How do you sit with this? So I did just a touch of that along with my EMDR. It was cool. Yeah.
Oh, that's fascinating. I've not.
Yeah. And it was like,
that.
it's like, you have to tell them you're okay. Or it's like, or you sit there and you listen and you're like, well, what's wrong with you? Like, what are you feeling? Why are you feeling? It's like it's like you're talking to yourself.
It's so good. This is my favorite theory by far. I just so fascinating. I mean, I do psychoanalytics more, but like when I want to go deep with someone, this is what I tend to have to run to. And something to know: parts are not just emotions. So people think inside out, so they're like, "Oh, my 5 emotions" or whatever.
Yeah. Mine happened to kind of like go into that, but
right, every person kind of gets organized differently. So sometimes there's emotion, sometimes it's just general concepts, right? There can be a perfectionistic part, right? Or there can be like the like disciplined part, or 12-year-old self could be a part, right? So there's just like a range of what your parts can look like, but they neurologically, like in your brain, it's basically like clusters of neurons that have like come together and are bonded through negative experience. So even on a brain level, there's like ways that they're mapped out. And Kelly, I feel like you're shocked. Like
I'm just like, I want to do this. I don't know what I need to, but I'm sure there's something I need to work on.
It is so.
Like, I've never heard of this, but I think.
So cool.
But some of that I think I processed during EMDR
a little bit. Yeah.
Oh, for sure. Yeah.
From the child, and you don't have to think that anymore. That's not who you are.
Right.
You were told that, you were treated that, but you're not.
Right. I like using this theory paired with EMDR because I love how much it emphasizes self-compassion. Because you really have to look at your heart and what it's doing from this lens of like, I just want to be safe and I just want to be loved. And every motivation of everything that you do is somehow rooted in that. And people really lose touch with that the more addicted they become, or the more, relationally problematic they become. Like, they really forget that, like, you're really trying to get a good thing out of everything that you do. So it really forces people into that reality. And then what I'll do is they'll encounter a protective part, and that once we work with that protective part, it'll reveal to us the underlying exiled part, the rejection or the shame or the, where the trauma is. And then we'll use that as the EMDR gateway. So that part usually has to be what's called witnessed to. And so you have to just like see it in its pain. Because that's the pain we've been shutting off for like decades or years, right? So you have to see it in its pain, which is what EMDR does, right? There's this third person observing that happens in EMDR. And then, once you see it in its pain, it feels consoled and loved.
Yeah. It helps you come to your authentic self.
Yeah, exactly. Yeah.
To live from that space versus that expected or whatever traumatized. It's like, it's so freeing to just go, I know who I am.
Yes. So I love IFS. A couple weaknesses. It's also very abstract and it requires a lot of feeling your feelings. It can stir up a lot, right? You're literally like shaking up your whole like mode of operation, right? Like if you're a machine, you're just like, you're like shaking up this machine. So sometimes like when the dust settles, your parts are not happy, or they are uncomfortable, or they like don't know what to do because they've been doing X for so long, and they're like, what do you mean I'm not, so it can get complicated. If you have like a good stable presence, that it shouldn't be too bad, but sometimes. And similar to EMDR, it requires a lot of distress tolerance and emotional regulation, because this is a trauma processing technique. You can use it for all issues, just like how you can use EMDR for most issues. But it was created actually for a dissociative identity disorder. So what used to be called multiple personality disorder, this is what it was created for, right? So DID, dissociative identity disorder, is like your parts that have gone so extreme out of so much need to protect you that they now take over your body and your personality and your psyche, right? But we all have parts, just not as rigid or intense as people with DID. So that's how it's now been applied to like the whole population.
That's so cool.
That's cool.
So good.
I love that. That's fascinating.
And I think through all four of these, there's just this underlying thing of this self-compassion, like as you work on whatever you want to work on, right?
I try to implement that. I think some theories are more dangerous than others. I think that's one of the issues with CBT, actually, is people come in and just want the fix, and it is evidenced to be one of the fastest forming treatments. But yeah, like you really have to understand, like, and that's, I'm a trauma specialist, right? I like the deeper, I like asking how to get here. But not every theory will do that, but I think self-compassion is so necessary when you go through healing, because you have to know you're already good. Like if you're operating from this place of like, I'm only going to be good when I'm no longer struggling, like you're never going to be good enough. And that's more dangerous. Like as a clinician, I'm always trying to watch for that, because it's more dangerous for you to believe that you'll only be loved if you're XYZ, right? Like you are not worthy and deserving of being embraced and accepted in the present moment. Now, are you maybe too reactive, and are you difficult in moments? Yes, like we're gonna deny that. Yeah, we're gonna like make sure we're aware of that. But to not like beat yourself up as you're trying to get better. I mean, like that doesn't make any sense.
Yeah, definitely. Definitely. I love it. Trying to think of the
I don't know. I'm just absorbing right now. This has been, it's been so good.
So informative.
And I think, I don't know. I just think And that's who I am.
Oh yeah,
the more I know about why I do what I do,
Yes.
Yeah.
the more I can be who I want to be and who I'm
Yes.
supposed to be
Yeah.
and
Yes.
meant to be.
And Kelly,
Definitely.
I feel like you got real lit up with IFS. So
Yes.
there's actually a book called Self Therapy. And it teaches you the basics of IFS. So I haven't done any formal training for IFS. I just read the book, but it was so thorough that I feel pretty well prepared on what to do. I have an IFS consultant as well, so I do have some extra resources. But Self Therapy by Jay something. I should have prepared it.
Okay. Yeah.
And we can
link
link
it up, and I'll link it.
Yeah.
I'll find it.
It like literally does it has like specific chapters that explain the theory, explains protectors, explains exiles. It has like step 1, do this, talk to your protector. Step 2, do this. Ask the protector to step aside. Yeah, it's like very, very systematic and practical.
Okay.
And then it has exercises all throughout the book that you can try to like do stuff with your parts. Yeah, it's a really good book. So if you feel like I want to try this out, but I'm either already in therapy and my therapist doesn't do it, or I don't have money to do therapy, or I don't want to go to therapy, but I want to like work on myself, I would really recommend the book Self Therapy.
Okay.
Very, very good.
Yay.
That's awesome.
That's
my
cool.
Gosh.
That's so fun.
I don't know if you have any final thoughts, Anna, and I know you wanted to plug something too, so whatever you kind of feel like you want to.
Yeah. Well, yeah, if you guys have any questions, do you guys have any questions that, or like just general thoughts as non-counselors, what is it like hearing about all these different
I love it. I mean, we use therapy so generally, which isn't bad. People should talk about it. People should do it. But I think like if you want to explain more how it really can help you, because some people are just like, well, therapy, what? I go talk and then what happens? No, like these are things that therapists can do for you and help you through. And like, it kind of just gives it a little more just like concrete, I don't know, helpfulness, usefulness for people who maybe don't know want to go to therapy.
Yeah. I think what you said, I mean, you've got to want to do the work. Right?
Yes.
Yeah. I mean, it just is. And so suppose, okay, I'm wanting to go to a therapist. How do I find a match?
Ooh, that's good.
Ooh, great question. Yes. So number one thing I really push for is above everything, you should feel safe. And that is a more like relational thing. That is not, I mean, competency is part of it, right? Like if you don't feel like that person's competent, that's like another area of safety. So you should feel like the person's competent. But like, are they going to hold your heart well?
Yeah.
And I know that's kind of like really like poetic language, but like, are you going to feel like you can open up to that person? Because if not, bad fit.
Yeah.
And you can give it a few sessions, but the science shows you should know within 7 minutes.
Whoa.
Really?
Yes, right. Like your heart is always asking, like, am I safe? Am I safe? Right. And so within 7 minutes, if you're coming and you're bringing an issue, like that's a vulnerable space. Like to go in as a client to therapy is vulnerable. And I recognize that. And sometimes it's so easy to forget as someone who like sees people hour after hour. But I'm like, wow, you like premeditated this for probably at least a few weeks before you call me. Like, I get it. And so within 7 minutes, your body knows, like, am I going to trust this person? Is this person safe for me? So that's like the number one thing. And then see, like, if you want, you can ask about their specializations. You can ask about, you can be specific about what you're looking for and see, like, and be really upfront. Hey, I have this issue. Do you deal with that? Like, do you, like, what do you want to do about it? Like, you can ask for a treatment that, someone's like, what are your thoughts? I'll be like, this is my initial thoughts. I still have to get to know you, but like, this is probably like a few options that we have. So I think be upfront about your issue. The really amazing thing though, and I love that we've talked about theories. I love that we're talking about all this stuff. I think it's important to have an idea of what treatment is going to look like. All of the research shows that 90% of healing people will accredit to the relationship.
Oh, that's cool.
Right. So yeah, and that's why it's like all therapy is like really good. I think you should maybe distinguish between like, do you want trauma deep work? Like, because that does shape treatment a lot. Or do you want something like CBT stabilization?
Yeah.
Because I would say that really determines like what your experience of therapy is going to be in terms of what you're learning.
Yeah.
But after that, I would say like find someone that makes you feel safe.
Okay.
Yeah. Oh.
And I think it's on the therapist too to go, there's somebody else in this building that has a more specialized for what you're going, for what you're dealing with, and
helping
to
in
do
that
both.
way.
Yeah. Yeah.
Definitely.
Yeah. A great question, Kelly.
So good. So good. But no, I'm glad we finally had an episode to like kind of dive into it.
Yeah, I think that's
definitely important.
Yeah.
Those are fun.
Yeah. But plug what you want to plug.
What you got coming up?
So,
You said.
Yeah, if this has inspired you to want counseling, I'm always going to plug my practice. So I work at Counseling for Life. It's the number 4, Counseling for Life. And so we are actually really good about if you call the front office and you ask for specific modalities or specific issues, they're pretty good at knowing like what is it that we're good at or what is it that we use. We're like on our website, it'll say who's EMDR trained or certified. And so we're pretty good at finding good matches. So if you want to go to therapy, go to Counseling for Life. And specifically with me, I'm actually going to be hosting through the practice, I'm going to be hosting a day retreat for the summer. So it's going to be a faith-based day retreat. The last time I did it, it was like 9 to 5-ish. Okay. So it does take up like a good chunk of the day. It'll be like talks, some exercise on healing, and some small groups and stuff. So if you're interested, you can email me with my name, Ana Maldonado, ANA. I'm actually, y'all can put it in the show notes.
We'll link it. Don't you worry.
Yes, link it down below. But yeah, with my name, Ana Maldonado at counselingforlifellc.com. So you can email me if you'd be interested in going. I would love to have y'all come. It is a young adult one. So like 18 to 30 is the general age range. We're not going to be like rigid about that, but
we'll be just in there.
We'll be in there.
Yes. We'd love
to have
when
it is?
What's the date?
We don't know the date yet, actually. So that's why you should email me. June or July, but I haven't.
Okay. So this summer. Gotcha.
Yes, this summer. Come hang out. Hear me talk more about stuff.
Yeah, I like it. That sounds cool. So yes, we'll link that, and we'll link the website, all of the
good stuff. Yeah,
for sure.
Perfect.
Thank you so much for having me.
Yes, absolutely. I'm so glad you came back.
Oh, yes. Thank you.
Yes. And yeah, for our listeners, we've got the rest of Mental Health Month. I can't remember when this is the month, but it's just May. It's Mental Health Month, so we'll be talking about it.
Yeah.
For sure. And if anybody has, if you think of any specific questions, we can always pass along stuff to Ana or, help you out in any way that we can. Or if you have any topics you want to hear us talk about coming up, you can always let us know. Instagram, Facebook, Patreon, all the places.
All the places.
Email.
So we look forward to next week when you take a breath and take a listen.
Thank you for listening to this week's episode of An Incomplete Guide to Personal Growth. There are many ways you can stay connected. Follow us on Instagram at An Incomplete Guide Podcast, where you can sign up for our email list and get posts that delve deeper into our weekly topics. Make sure to subscribe to our podcast page wherever you listen to your podcasts. We would really appreciate a rating and sharing us with your family and friends.
We're so glad you chose to spend your time with us and hope there was a thought, a resource, or a laugh that you can take on your journey. We'll be here every Tuesday for you to take a breath and take a listen.